All right, so you're in the right room if you want to learn about physical therapy and walking and balance. If you don't want to hear from a physical therapist who's experienced in this, you can go. We've got Christina Bebb here. She is a wonderful physical therapist at the Medina Hospital, and I send many of my patients to her there, so she's going to give us a lot of good info today.
Thank you. Hello, can everyone hear me okay? All right. I apologize if I'm too loud or too fast. I have that habit, so I'm going to try really hard to slow down. As Shannon mentioned, I'm Christina Bebb. I've been a therapist at Medina Hospital for coming on 11 years now, working mostly with Parkinson's and other neurological disorders. And I was asked to talk about walking and balance related to Parkinson's. So just a little bit about what I'm going to talk about today. I'm going to be talking about the changes that you may experience sometime in your diagnosis. I'm going to talk about strategies to help those problems. That's hopefully what you get out of this talk. I want to talk about some fall strategies that kind of goes hand in hand. And then lastly, talk about home safety and fall recovery very briefly. So I hope it's obvious why this is important for you, but just in case, couple topics of why Parkinson's and walking are so important together. So first, it's your independence. This is one of the biggest things my patients say is I want to stay independent. And you getting from point A to point B is your independence. In addition, confidence. I want you not only to be able to walk, but walk confidently. I don't want you to be afraid of falling. And people who are fearful of falling actually tend to fall more. In addition, kind of going with independence, this is your quality of life. As one of our speakers talked about, doing things that are important to you, those affect your quality of life. So if you can't walk to get to those things or while doing those things, that can affect you. Also, exercise. One form of walking or exercise is walking, but also just to get to your exercise class or to get to the rec center, that can be a very important thing, is just being able to physically get there. Also, in terms of independence, if you're able to do more for yourself, you're helping out your caregiver. I already mentioned falling, but it's reported that 90% of people report falling once and 39% more than once. I think those are probably underestimated because not everyone tells someone when they fall. Important tip, you should do that. And then quality matters. As I mentioned before, I don't just like to see my patients being able to walk, but I want them to walk well. Just a little bit of tidbit of information. A lot of Parkinson's gait issues can be related to medication changes. So either your meds are wearing off and you're starting to have walking problems, or you're in that on-off cycle and you're starting to have walking problems. Maybe your meds take a while to kick in, so you're starting to shuffle during that time, or you have dyskinesias and they're throwing you off balance. Although I try to work on this with my patients who have Parkinson's, I do like to say this is a conversation for your neurologist to say, these are when I'm experiencing my walking problems, because I can't change your medications as a physical therapist. So definitely have a conversation with your doctor. So these are the gait problems that I'll be discussing today. This is only a small handful of the things you may experience or your significant other or family member may experience. And I'll kind of go through what it looks like, what causes it, and more importantly, what can you do about it? Okay, so hypokinesia, you've probably heard hypokinesia and bradykinesia a bunch today. Basically, just think small and slow. So I'm going to talk about the small first. This is probably the biggest thing that I see with my clients. So I'm going to switch over to the mic. Can we hear me? All right, so when we think of small walking, I want you to think of smallness of your steps, but also smallness of the body. So we see small, short strides. We see downward gaze, flexed posture. My patients will say, well, my family says I shuffle. These are all quotes from patients. So what makes this happen? First, that posture that I mentioned. We'll see stiffness in some of our muscles. We all may experience stiffness in this room, specifically of the shoulders coming forward, bum coming out, knees becoming flexed, and those tight areas in all those regions. We also might get an impaired kind of knowledge of what you're doing. So this is why I brought up, my family says I shuffle. A huge piece of this is recognizing that you're doing it. I have a lot of clients who I'll say, well, do you think you shuffle? And they're like, no, I think I do pretty well. And the family member's eyes will bug out of their head and say, what are you talking about? So recognizing that you're doing it is a huge part of the problem. Environment is also key. So some of my patients will say, I shuffle in tight spaces, turns in the bathroom, in the kitchen where I don't have a lot of room to move. And then again, medication fluctuations. So some solutions. So some easy fixes are to address some of those tight areas that I mentioned. So those tight chest muscles, we want to open up that chest, stretch the pecs, stretch those neck muscles, stretch the front of the hip where we tend to be tight, and the back of the legs, those hamstrings. We also want to work on your mobility. So our ability to turn. So that's going to help in those kind of areas that involve turning, like those tight spaces. We want to work on our posture muscles, so strengthening those muscles that pull you upright. If you can, try to make your environment more conducive to a nice walking pattern. So maybe move the coffee table a little bit so you have room for your walker, or maybe get rid of some of those items on the steps so that you aren't afraid of tripping on them and clearing the steps, or maybe move the garbage can a little out of the way so you have room to move. And then if you haven't been to physical therapy, and if you hadn't had a therapist say this to you at any point, find one that does, because the biggest thing you will hear me say to every single one of my patients is think big. Big steps, big posture, big movements. You'll probably hear me say this 10 more times today. In terms of exercise, I always say any form of exercise is good exercise, but things like dancing, drumming, yoga, the LSVT Big program, those all work on those big exaggerated movements. This goes hand in hand with the small, but also the slow. So this is slow movements, again, coupled together usually with the small. So we see slow steps, small steps, and it doesn't always have to be the walking. Sometimes it's just getting into the position to walk. So it takes me 20 seconds to get up from the chair to move. Now I've just wasted a lot of energy, so I'm taking longer to get where I need to go. And this is what my patients will say, things just take forever. It just takes me longer to get to the bathroom. So again, just like before, this can be exaggerated when we have rigidity or stiffness. This can be exaggerated when we have a lot of tightness in certain areas and poor posture. In addition, if we have some slowness of thinking, if I just need to think about what I need to do more, this can be a little more difficult. And then again, medication fluctuations. So just like before, we can already see think big. That can very much help with this issue. In addition, we want to do exercise or activities that help us with high effort and high amplitude movements, and we want to get our whole body involved. So when you think of exercises, if we look at that list, boxing, cycling, interval training, the big program, those all involve the whole body. They all involve the trunk muscles and getting you big and upright. And they all kind of involve a lot of those rotational movements that we see with boxing, or if you did some of the boxing next door, you might have done a lot of twisting motions for a reason. So those are just a couple ideas. Freezing. So this is something some people experience. Not all of you will experience this. But freezing is that temporary kind of unintentional stop in your movement when you're walking. It can also occur with other things like getting up to stand or going to sit. So sometimes you'll also see the person walk with smaller and smaller and smaller steps until they freeze. So it can also look like that. Sometimes this can happen as well when the person just first starts moving. So I have trouble getting going and breaking through that freeze, and now I'm good. And this is something my patients will say is, it just feels like my feet are glued to the floor, or like there's cement bricks on my feet. So what could cause this? Environment is a huge kind of factor in this. Small spaces, doorways, thresholds, changes in the flooring, when we're going from like carpet to tile, elevators, any of those things where the environment changes. Also, again, if we have to think more about what I'm doing, now I can't think about my walking, and that makes it more difficult for me to get over that freeze, or it might cause me to freeze. Again, medications can play a role in this. Stress or anxiety. And so when I have someone who freezes, I will often ask, are you stressed or anxious when you're in this moment? And some people will say no, but some people say, yeah, I'm worried about freezing, and then they freeze. So stress and anxiety can play a role, and then a need to rush. So maybe it's, I'm running late for this talk, or I'm running late for my doctor's appointment, or I need to hurry up and to go to the bathroom so I don't have to have an accident, and I freeze. And so all of those can be kind of factors that play a role. So this is a long list of things that you can try. For me, freezing is very individual. So what works for you may not work for someone else. So the first thing I will always say is just stop. Stop trying to move, reset, maybe take a deep breath, and try again. It's very hard to kind of stop freezing like mid-motion. So if you stop, take a deep breath, that goes a long way. Again, big steps. I'm going to say it over and over because that can really help not only physically, but your brain if you think about taking a big step. Sometimes even just shifting or marching, and kind of that can take your mind off of the freeze and get you start moving again. A big one, especially for doorways, elevators, changes in the flooring, I say look off in the distance. Don't look at the floor. Don't look at what's causing you to freeze, but look off in the distance. That can do a lot of good. Other people, music or a metronome can be very helpful. Music has a very rhythmic nature. Walking has a very rhythmic nature. Left, right, left, right. Humming a tune or literally playing music or a metronome on your phone can also be very helpful. And then a visual target. So we'll talk later about a walker that has a target or a laser on it. That can give you an idea of when you're freezing, giving you that space to step. And in terms of exercise ideas, sometimes I'll suggest things like high intensity exercise, cycling, or the Power Move program. If you haven't heard of it, look that up. But there are some stepping exercises specifically that can help with freezing and help with that problem. Initiation, again, this goes hand in hand with the freezing, but this is when you, especially when you first start walking, you start having a trouble or freezing or shuffling at the very beginning. And my patients will say, it's just that first 2 steps or 3 steps. Once I get going, I'm fine. So we can see this with that slow thinking, so more cognitive effort in order for me to walk, or just thinking about what I have to do. So if I can't recall all the steps I need to do to get up from the chair, that can sometimes cause me to have trouble with this initiation. And just like the last one with freezing, stress or anxiety can make people have trouble. And also impaired posture. This is what I see all day long in the clinic. So someone goes to get up and they start walking. And if we look here, I haven't even finished standing up and I'm already trying to walk. So when I talk about problems, the next step would be actually getting up. So I'll play that again. So this is the person, they're going to get up and walking, they're going to get their remote. I haven't even finished standing up. So if you're having this problem, I want you to finish standing up and then start walking. So we talk about that here. So correcting that posture, straightening up. Again, we can also try things like shifting, like we do with freezing. Also, another trick to try is if you always start off with the same leg, try changing legs. That can sometimes just trick your brain into figuring out what it needs to do. And again, think big. In terms of exercise, interval training, where you're switching from maybe one task to another, or starting out slow and then going faster and faster for a short burst of activity, or Tai Chi, where you're moving from one task to the next. Impaired dual tasking, or what most of my patients say, doing 2 things at the same time. This can look like trouble walking and thinking or talking. So having a conversation with your spouse, or talking on the phone, or thinking about what you want for dinner. Or while doing a motor task, so getting your keys out of your pocket, holding onto your cell phone, trying not to spill your hot cup of coffee. Or, and this is what my patients will say, well, I can't talk and chew gum at the same time. So what could cause this problem? Again, as I've mentioned before, if we have to think a lot about each step that I take, and now I'm thinking about not spilling my really hot cup of coffee, what am I gonna think about more? I'm probably not gonna wanna burn myself, so I'm probably gonna think about that, and I'm not gonna be thinking about taking big steps or standing up straight. So that increased effort of thinking can be a huge piece. Also, kind of goes hand in hand, impaired attention. So if I have a lot of distractions going on, that can also affect this as well. And then kind of to go with that, with distractions, a busy environment. So this is a great example. There's lots of chairs. There's lots of people that you're focusing on not tripping on over them, and you're not thinking about your walking. So what can I do here? So very obvious, but let's try to limit the distractions. So turn off the TV. Tell your family member, you know what, we'll have that conversation, but let me get to the kitchen table first. Don't be talking on the phone while you're walking. Also things to make carrying easier. So instead of carrying your mug of coffee, how about a cup of coffee with a lid on it? Or I had a guy earlier ask me for a cup of coffee, and he said, can you just fill it halfway? Easy solution, so you're not worrying about filling up spilling your cup of coffee on yourself. Also, for getting your keys out of your pocket, wait till you get to your car, and then get your keys out of your pocket, or your cell phone, or whatever. And things like fanny packs and purses, crossbody bags are great to help you carry all your stuff, even in the house. So if you need to carry your remote, your pack of tissues, your chewing gum, all in the house, put it in your fanny pack instead of trying to carry all those items with you. In terms of exercises, I will sometimes call it safe dual tasking. So while you're on your exercise bike, your recumbent exercise bike, you could be doing cognitive multitasking. So for the next minute, you're gonna try to name as many colors as you can, or you're gonna try to name as many sports teams as you can, or you're gonna practice taking a dumbbell and switching it from one hand to the next. Those are safe because you're not worried about falling, but you're exercising and trying to maybe maintain that revolutions per minute all at the same time. Also, if you are ambulatory and not tripping while multitasking, you could practice this while out on your walk, maybe from one house to the next. And then lastly, postural instability. So this is just a fancy way of saying balance. So this is when my patient who either maybe has a lot of sway in their midsection when they're walking, or they feel like their feet are kind of really wiggling a lot when they walk. I see this also a lot with dyskinesias. And my patients will just say, I just feel like I'm gonna fall. Or you can see it on their face. So what might cause this? It could be impaired posture. It could be an impaired sense of gravity. Those two kind of go hand in hand. So think about it. If my posture is forward, my center of gravity goes backwards. If I get a little bit unsteady, I'm gonna fall back. And that's usually the direction most of my patients tend to fall. I can see that issue also with ankle tightness. So if I don't have enough flexibility at my ankles to shift my body weight over my feet, again, I'm gonna be more likely to be backwards on my heels. Same with ankle weakness. Maybe I don't have the strength to maintain that position, or I have some side-to-side ankle instability. Also weakness in your core, your trunk muscles, so that's where we get a lot of wiggliness in your midsection. And then unrelated to Parkinson's, maybe you have neuropathy in your feet, or you have some severe vision issues. That can also cause some issues with postural instability. So what can help? So a quick solution is an assisted device. So not everyone's always willing to use a device, but I say I would much rather have a patient walk well with a cane or a walker than fall all the time without one. So huge, huge factor. Think about that when you're kind of not sure about it is, do I want to walk well, or do I want to walk without my device? In addition, in therapy, I work a lot on learning where your center of gravity is. We can do that through using a mirror or using some specialized equipment, but learning where actually you should be in terms of your balance. If you do have trunk or ankle weakness and flexibility issues, we can work on that. And then again, working on those posture muscles so that we're not flexed forward with our weight back, but we're upright. And exercises that can help with this are things like Tai Chi, or again, that power or big program. So I just mentioned assisted devices, so hopefully none of this is new to anyone, but there's kind of two types of devices, one-handed devices and two-handed devices. So one-handed devices like a cane or a walking stick. Big benefits here is they're usually very cheap, they're usually very portable, but mostly, in my opinion, they help mostly with minor balance issues, not for severe balance issues. In addition, I always say you want to think about the cognitive effort it takes to use a device. There's a right way and a wrong way to use a cane. Carrying them is not one of them. So if you're using your cane, it should be sequenced properly. And if you have to think about, okay, cane with the left foot or cane with the right foot, again, that can sometimes mess up the walking cycle and may not be the best choice for you. In terms of cane versus walking stick, I do like that walking sticks do tend to get my patients a little bit more upright. So that's something to think about if you're choosing between these two devices. So you can see the guy on the right, he just tends to be a little bit more upright. So two-handed devices can be something like a walker, a rollator, or one of these types of rollators in the middle and on the right. So you have your traditional rollators. I really like the second one from the left. That's called a nitro rollator. I see some of you with one today. I like them because they, again, get you a little bit more upright. You can get a little bit more inside of them than the one on the left. And they have sometimes can have larger wheels, so for outdoor surfaces. The one in the middle is a walker that was mostly geared for people with Parkinson's disease, so it's called a U-step walker. Again, I see some people here with one today. These are walkers, just like the Nitro, they get you a bit more upright, but they also have a really wide base of support, and they turn, in my opinion, a little bit more on a dime. So for those people who have trouble with tight turns or tight spaces, they can turn a bit easier. And then they also can be equipped with a laser light or a metronome. So when I mentioned freezing, these can be a great tool because they can come equipped with that metronome that I mentioned, or a laser light to show you where you look when you're walking. Big negative of the laser light is you do have to look down. So if you're looking for that while you're walking, you're also looking down. And then lastly, the upright walkers. These are kind of newer in terms of rollators. All they are is a rollator with upright support at the forearms. And so for my patients with trouble with those trunk muscles getting upright, this can be a really good tool. Biggest negative is that they are a little bulkier, so loading it like in and out of your car can be a little more difficult, or like getting it in between some tight spaces can be difficult too. I have to throw in a tip about home safety. So again, we mentioned we're more likely to freeze and shuffle in small spaces. So if you can make your environment a little bit more spacious, in addition, removing any fall hazards like throw rugs or electrical cords or things on the steps. So all of those pictures on the left are things you shouldn't do. So obviously try to make it not look like that. But you'd be surprised. Family member will say, won't let me move that trash can, but if we just move that trash can, you would be not tripping on it all the time. And then very last, I was asked to kind of just touch base. So if you do find yourself in a circumstance where you do fall, what should you do? Now, if you're injured, the obvious is don't get up, call 911 or call for help. But if you're fine, but you just don't know how to do it or you don't know the right way to do it, I'm gonna show you. So I'm gonna talk first, show second, or try to show and talk at the same time. So if you find yourself in the position of being on the floor, what you're gonna wanna do first is roll your body or hips over to where you're at. So if I'm on my bottom, I fell, I'm okay, I'm gonna rock my knees towards what I'm using to get up. If you don't have something, have someone go get you something. A chair. I've even taught patients how to get up with an upside down Home Depot bucket. So if you're in the yard, it's a good trick. Second, you wanna get up onto both knees, just like this. And then if you have a stronger leg, you wanna get that one leg underneath you, and then using both hands, I'm just gonna use one since I have a mic. You're gonna use both hands to get that second leg underneath you and come up to stand, and then hopefully just sit if you can, just to kind of stabilize yourself. So we'll do that one more time. We're gonna get on both knees, up onto our knees, up onto one foot, push with both arms, and get to stand. If you're a caregiver, the best place, in my opinion, is to be kind of at their hips. I see a lot of family members grabbing an arm, and now you just took away what the person needs to use to get up. So that's the person sitting on their bottom, their family member takes both of their hands and tries to pull them up. Now you just took away what that person needs to use to get up. So I usually say be here at the person's hips, kind of helping them guide themselves or helping them get up. Or if you can put a belt around someone's waist to give them a boost, like a gait belt or even a belt from the closet to give a little boost. All right, so hopefully some key takeaways. First, gait and walking issues are common with Parkinson's disease, but there are things we can do about it. Exercise can help address some of these issues. If you're falling, consider a device, making your environment more safe. And lastly, consider physical therapy if you are having some deficits, because this is a very individualized issue. As you can hear, there's a lot of things we can do. So ask your neurologist for a physical therapy referral so that we can work on these things. Hopefully you guys enjoy my talk and learn something. I'll be up front if you have any other questions. Thank you.